Patient came in the other day, late 30s, in a rear-ended car accident. Immediate symptoms in her neck: hyperflexion, hyperextension. She was interesting because she had a multitude of symptomatology that you'd expect: pain, radiant pain into the shoulders, stiffness, couldn't sleep, headaches that were fairly consistent. Additionally to that, she had lower back pain. Another common injury when you have an automobile accident. Additionally to all those things, I found this rather interesting. She had pain radiating into the jaw and the mouth. She had a burning mouth sensation, which was unusual. We examined her, x-rayed her, and we did another thermograph. And it was interesting. The sympathetic areas that innervate the area where the symptoms are seemed to be involved. They seemed to be injured, inflamed, swollen. Upon further examination, the range of motion in the area, the ability for that joint to move properly, that wasn't working like it should. First thing that comes to your mind, of course, at least for me, is the cranial nerves, and the cranial nerves are all intact here. But the autonomic input to that area comes from right here in the C1, C2 area. That's the other part of the nervous system. So she's got an injury. If you look real closely, this looks kind of crowded in here, kind of, bunched up, if you may. And it is. And if you look closely here, there's a break in that posterior vertebral body line, which is another indication of swelling, inflammation, trauma to that area. So this is very suspect as a causal agent to her symptoms. Down here, there's another spot down here that's suspect as well. So when you examine an x-ray and evaluate and try to diagnose, these are very important elements that you want to look at. Now, additionally, what we've done is we have taken a thermograph. What that does, of course, is measures the temperature, as the name says. Look at the spike right here. 2 degrees change here. Red is 2 degrees. Orange is 1 degree. With another thing I didn't mention, it's hard to illustrate, but right here there's an injury to the thoracic spine, very common. You can see it showing up here with a degree or so change right here. So, and that's a change in the temperatures, the difference from around the skin around that area of the spine. So what we're looking at here is another piece of evidence that points towards where the injury, where the causal agent to the problem is. Very illustrative right here. Lower back, she's got lower back problems. Look down in her lower back area. Oh, look, there's an orange. There's a whole degree shift there too. And you can see on the x-rays, there is a element and suspect area to cause that as well. But that's the correlation and utilization of different diagnostic modalities to help you understand what injuries to the spine can be and how to schedule a treatment plan to treat that. Treatment plan, very interesting. You're going to see this patient pretty aggressively initially. You want to bring down the inflammation. You want to get the patient so there's more and more comfort there, less and less discomfort, less and less inflammation. I'll see her probably, I would think, on a quarter of 10 times in the first 2.5 weeks to bring this down. After that, treatment wanes down. She has a good prognosis here. If you or anyone you know has an accident, a boating accident, a car accident, do them a favor, do yourself a favor. Pick up a phone and dial 941-362-2000. Come see us at the Automobile Accident Injury Clinic here at West Coast Spine Center. We got your back.